Myself, Dr. Parimal Gharia. I am a consultant urologist and robotic surgeon. I am based at Surat. I am having my own hospital, Icon Hospital, Surat. Since my residency days, I was doing laparoscopy, and we were doing a lot of laparoscopy here. But after robot came to our armamentarium, we could do a lot of complex surgeries, and we could do very comfortably. And the ergonomics are so good that I do not have to stand up in a awkward positions or lifting the kidney on awkward position, retracting the organs in a difficult position, and sitting on a console with the 3D magnified view. You can see the minor details about the vasculature, the composition of the tissue, and then the dissection becomes very easy and very meticulous. And that's the biggest advantage. The tissue manipulation has improved a lot after coming to a robotic platform rather than the laparoscopy one. The robotic platform has made it more safer. It has the amount of the constraint in a closed spaces. It was very a difficult task to perform a laparoscopic surgery in a pelvic organs, which is by coming to a robotic platform like SSI, the total dimension of the surgery has changed. And I think we should take an advantage of this system, because as a Make in India system, and it's customized according to our needs, our setups, our requirement of our patients. It can be modified to any surgeries, and that is the biggest advantage going towards the robotic surgery. I think the future is very bright for robotic surgeries. Previously, the robotic platform was available to very few number of surgeons and a very few centers. When SSI come into the picture, it has disseminated to a level where it can actually benefit to the patient class who was not going for a robotic surgeries previously, because either of availability or the cost. We were amongst the first to have a robotic platform, Mantra 3.0, in a private setup. What I can say, it has democratized the robotic surgery rather than keeping it to a very few selective centers. Frankly speaking, I did not have any experience of any other robotic system before SSI Mantra. We have directly shifted from the 3D laparoscopy to a SSI Mantra, and what I can say is the services that were provided to us, from the training at the center, the training at on-site training, and the training during initial cases by an SSI team, was an excellent and at par with anything else, and which has made us very easy to shift from the laparoscopy to a robotic system. We did not feel at any time where we were operating some complex machines, or we were some alienated from the things, and we are doing something new. It has a naturally progressed to robotic surgery without any hiccups. I can say to my fellow surgeons or who are not on the robotic platform that this is a future. You have to embrace, you have to develop your skill to a robotic surgery, and let me say that this robotic surgery has made your laparoscopic urological surgery more easier than when you are operating without a robot, and if you are operating with the robot, your surgery skill becomes to a next level, and if you can give a better results for that. I can say that the approach of SSI towards the robotic surgery, it is what we admire more, because when we have adopted from laparoscopy to robotic surgery, we as a surgeons are always anxious about how it will go, how it will perform, how we will be trained, or how we will be able to cope up with the requirement of the new setups and the new challenges which will be coming. But over a period of time, when we approach to a robotic surgery through an SSI, I think that they have set up as a way that you can gradually go into that way and become a successful robotic surgeon. Overall pain of the surgery has decreased. The patients are more comfortable, and I think they are going very early home and resuming their day-to-day activities after adopting to a robotic surgery compared to a laparoscopic surgery. I can say that you have made it possible for a lot of us Indian surgeons to get on to a robotic platforms, and by adopting your robotic platforms, we have reached to a certain milestone, and you would like to go further and reach the milestone which is as a world level.